All right, we've been talking about it a week. I had to go through a week of being Miss Tomato Head and all kinds of names.
And it really looked worse than it felt, did it really?
It did. People looked at me and, you know, were kind of taken aback, but they were always thinking I was in pain, and I never was in pain. I just had a bright red face because I had the laser pearl.
They want first-hand experience. And, of course, we have on regularly on our show our expert, our cosmetic and medical aesthetics expert, Dr. Tahl Humes from Tahl Spa.
That's right.
And clinic. She's a doctor. That's what I love. She's
an MD. She's an internist, and she works at a couple of different hospitals around town.
Yes, yeah. So she actually, that's what I like. You know, a lot of people say they have a doctor on staff who comes by every now and then and says hello. But you own the place. You are there.
And
you are there. It's yours.
I do some of the procedures. We also have laser specialists and nurses that work with us as well.
Okay. Yeah.
Let's talk about first the pearl laser. We've gotten a lot of email about it. What did you do to her face? And what good did it do?
Well, it did a lot of good. Paula's skin looks incredible.
Thank you. Yeah. I'm really pleased with it. I'm so pleased. And I had tons of the sun damage and really heavy spots on both sides of my face, but mostly the right side. I don't know if you can get a tight shot of this area right here, but that's what I was really focusing on and was unhappy with. In the last 2 years, I've been talking to different people about doing
now, makeup is not just covering that up, right?
No. We're going to show the before and afters. Yeah. You can barely see it. See, light pink now. Okay. They used to be really dark.
Now, of course, you had one treatment.
One treatment.
But
and she thought it would
Dr.
2 or 3,
Humes,
right?
how many treatments do people normally get for heavy sun damage?
We recommend 2 to 3 treatments. With that being said, you're going to definitely see a result after just one. So some people do one and like, you know what, I'm good for right now. But for the most part, we recommend 2 to 3 treatments.
And does it renew your skin?
It does. It absolutely does. The reason they called it pearl was because what it's doing is it's treating the entire top layer of the skin and leaving with a nice pearly layer underneath.
And it does feel more plump. And you were saying that when it gets really hot, and it does definitely get hot, that promotes the collagen production.
Exactly.
Tell us how that works.
And here it is being done now. Paula, so what did you feel right there?
Well, I had the numbing cream on for an hour before this, so I felt very little. It felt like a popping, and it sounded like a popping. It got very warm afterwards. Just as soon as she was done, it kind of heated up, and I felt this heat in my face, and kind of, I would say, kind of a throbbing heat. It wasn't painful, but I could feel it kind of throbbing, and it was uncomfortable, and I took some Advil because it gave me a headache.
Yeah, for me, what happens when I have it done is that I feel like I have the worst sunburn of my life right afterwards.
Yeah.
Lasts about, 30 to 60 minutes. And then, like you said, occasionally from the heat, you'll get a little bit of a headache. It just depends on the person.
Yeah, for about 90 minutes, I was uncomfortable, and I would just put my face right in front of a fan. You gave me a little walk-away fan to put in my face, or the air conditioning.
In addition to laser, you do a lot there.
We do.
What are some of the more popular procedures?
One of our most popular is Botox. I mean, everybody could use a little bit of Botox, but we do a lot of Botox.
Is that just to keep wrinkles off your forehead, or where do you use it? Where?
Well, we use it all over the face. I mean, it's FDA approved for treatment between the brows, but we use it on the forehead, around the eyes, in the neck.
Does it smooth you out?
It does. It absolutely does. You know, if you can use it as prevention, it's even better, because once the lines are etched in the skin, they're a little bit harder to treat. But we have 22-year-olds who come in to prevent wrinkles.
Now, do you mind if I ask, because you have 0 lines in your forehead, did you do Botox?
Oh, yeah. Absolutely.
Okay.
And how many times have you done it?
I've done it multiple times. I've been doing it for probably the last 5 years.
But you don't look stiff or fake, and you can smile.
Yes.
No,
you have
really.
a lot of expression to your face.
The reason we're saying that is because you see some people and they're like, oh, yeah, I didn't have a thing done, So.
Yeah, no, our goal is to keep you looking natural, looking your best you. What we want to do is enhance what you have, reduce those wrinkles without making you look like you have no expression.
Right.
I think that, Hollywood kind of gave it that, that sort of masked faces-esque,
Yeah, and you can see some really extreme cases out there of Botox gone bad.
And by the way, coming up, and I'm not going to give it away yet, we have a very special offer on that pearl laser. I just want to remind everyone to stay tuned for that.
Which, by the way, you've done the pearl laser to your own face.
Yes.
What for?
I've had somebody else do it to me. I can't do it to myself.
Well, that's right.
Let's look at the before and after pictures of some sun damage with Paula. And you can see...
So in the before picture, you can see on her cheek, see those 2 large sunspots that Paula was pointing out before?
Yes.
You can see that they're reduced. It's hard because right now Paula's still in that phase where she's a tiny bit pink.
Yes.
Where if we do those after pictures in about a week after we do a microderm or dermaplaning, it's going to be even better.
And we can follow it. We can follow it.
So, but you can see, I mean, especially
now here's her progression on the air.
Through the week, which was pretty rough, I have to say.
We had to explain to people right away. They said, well, we just hope Tom hasn't been hitting her.
He is kind of mean,
Look at
but
that,
he didn't
seriously, you can see that she got red, and then...
And this is where it was starting to peel off, and then the dark spots got super dark.
And you're very brave, Paula. There's not many women, seriously, that are going to come on the air with 0 makeup.
And this was no makeup. This was and no makeup on my face except for mascara and lipstick. So I was really pleased with how the skin was looking.
So that was in the beginning again, right?
And now here we are.
That was day one.
That was day one. And then, of course, back to now. And really, there is a difference. And I was watching you in the makeup room.
My husband really tell the difference. My husband is like, I can't believe.
So you're actually using
less
makeup
without makeup
now.
all the time.
You're using less now, I noticed.
Absolutely. I mean, I'm still going to wear makeup for television and stuff. But when I'm out, my street makeup, I go very little.
Can you explain
I'm very pleased with it.
What is a photofacial?
A photofacial is an IPL, which is intense pulse light that targets the browns.
It's not laser.
It's not. We call it in the laser family, but it's actually a flash lamp. So it's a light that targets the browns, and it lifts them from the top layer of the skin. It lifts them, and then they flake off. You can actually do it right before you do the pearl and lift them even more. So sometimes right before we do the pearl, we'll do the photofacial or the IPL, and then we'll pearl over it. So what we're doing is we're lifting those brown spots from a deeper layer up, and then being able to treat them with the pearl, where we treat the entire epidermis.
Therapy?
Veins, what we can do is we can collapse veins of the legs and the face. So for people who get really red.
Permanently?
Semi-permanently. If you're prone to make veins, you're going to keep making them. The ones we treat are going to be gone, but if you're prone to make veins, you'll keep doing it from your sun damage.
We should mention we could take a call or two for Dr. Tahl Humes, and she is our expert here at Aesthetics, and she is a doctor. And maybe we'll ask her to stick around even to come back if you do have some questions. We tend to get into a time crunch, but 303-771-HELP. 303-771-4357.
And some of the people were asking me through the week, is it painful? And the main thing I would have to say was, no, it's not painful. It was uncomfortable there in the very beginning. But the one thing that I wasn't really prepared for, I guess, was just that the couple of days where you're looking at yourself in the mirror going, what did I do?
I wonder if it'll come back, right?
Yeah, and you were saying all of your patients do that. They come in, they're all excited, and then the next 2 days they're like, oh, what did I do? Yeah. And you do. You absolutely go through that, and then you start coming out of it because you start seeing the progress. And you're like, okay, this is.
And I think one of the hardest parts is when you're used to wearing makeup every day. And we have a lot of men do this as well who don't wear makeup every day. But when you're used to wearing makeup every day, all of a sudden I tell you can't put it on because you need to wear something greasy like Aquaphor on your face.
By the way, we're going to have a special coming up, but I have to ask about lipo dissolve because it sounds like fat dissolve. Is it?
It is. We're not doing quite as much lipo-dissolve as we used to because we started to do laser lipolysis or vasolipolysis. But what lipo-dissolve actually does is it breaks the wall of the fat cell so that the body can reabsorb it.
Does it help?
It does help. Yeah, we've moved on though from there more into the ultrasound guided or vaser.
Okay. Now Yvette
has on the line.
She has a question. Yvette, hi.
Hi. I've got a mole on my face between my eyes, and I'm wondering whether or not they can effectively remove that.
Okay,
a mole between the eyes, is it?
Yeah, on her face between the eyes, and she's wondering.
Do you remove moles?
I don't. Our plastic surgeons sometimes will. It depends on whether or not it looks like something that would need to be sent to pathology or not.
Right,
just because we're all cosmetic.
But let's say it is cosmetic and it's not cancerous. You do remove those?
We do, yes.
Okay. Yeah, they do have full plastic surgery at the
Yeah, you have a plastic surgeon who works with you, and of course you're an MD, an internist, and you've got this spa. Tell us where it is, and it's really easy to get to. I know where it is, right there in Cherry Creek North, and we have a wonderful special too.
Yeah, it's on Steel Street between 2nd and 3rd.
Okay, Steel Street between 2nd and 3rd.
So right in Cherry Creek North.
Now,
it's a beautiful spa.
The pearl laser that Paula had done, and this is a major resurfacing, and it did not hurt.
No, there was no pain. It was uncomfortable for about 90 minutes.
But man, did it make a difference. $500 off, and that's through the end of July. Now, you mentioned Martino TV, Tahl Spa, and it is in Cherry Creek North, and we call it Tahl because of Dr. Tahl Humes.
Dr. Tahl Humes.
And VIT, which is taken from life,
Vitality.
Yeah. So we're proud to have her on staff here and coming in regularly. So if you email us questions, we'll get them to her and have her answer them next time around.
All right. Thanks a lot, Dr. Humes.
Thank you.
Appreciate it. All right.
Your skin looks great.
Thank you very much. I'm very pleased.